Hello, good evening. This is Ellen Teeter. I'm the Executive Director of the Florida State Oriental Medical Association, and I have President David Bibby and Vice President and Advocacy Chair Jennifer Broadwell with us tonight. We've got a lot of news, and so let's get going. The first thing I want to talk about is upcoming events, and these are the most immediate, except the conference is the biggest, August 13th through 15th. You can go to FSOMAcon.com and find out about all our speakers and the event. We will have 3 live tracks, and one of them will be also broadcast virtually, but we hope people will come. We've already got 25 exhibitors, and we've got some great events planned. So take a look at that. If you have questions, feel free to call us 1-800-578-4865 or email me director@fsoma.org. So also Understanding and Treating the Aging Face is coming up. I didn't put the date on there. Look on the FSOMA.org website. It has the dates and information, and a brief 1-hour looking at some mandatory things coming with documentation for us, and that's coming June 15th at 7, and that'll be with Galena Rufner. So we had a great event in Clearwater. We were at the table. I don't know if anybody remembers that our old lobbyist, John Mixon, used to say, if you're not at the table, you're on the table. So we got there, and we had 5 acupuncturists and 1 support kind of person, and we sat and schmoozed and ate some breakfast and heard some political people talk, and it was very interesting. One Representative Chaney from St. Pete talked about just having been assigned to a cancer committee, which is called CCRAB, and it's been going on for a while. They have legislators, they have players from the cancer centers. We're hoping maybe we can get a seat at this table. But if not, we met with her this morning and gave her some great information about acupuncture, how we're already involved in cancer care, how we can help with a lot of the factors that are risk factors for cancer. So we gave her handouts and research. There's not a lot of research on preventing in the first place, but there is quite a bit on integrative medicine, acupuncture, herbal medicine, helping with preventing a reoccurrence. So we shared that. And she asked us to help with what we could find about using acupuncture in prisons. So if anybody out there knows about the Miami drug courts, or there used to be a program in St. Petersburg, please send me information. I will be reaching out to people in Miami and seeing what we can find out. I know there used to be acupuncture as part of the drug courts in Miami. And apparently there was something in the jail or prison in St. Petersburg. So if you know anything about that, let us know. Okay. So it was a great connection that we made, and hopefully we'll get some good traction out of that. So I'm going to turn this over to Jennifer to talk about some cautionary tales now.
Thanks so much, Ellen. And just wanted to bring up some of the things that are happening in some of the other states. There's so much variance and nuance among each state of the US in terms of acupuncture profession. And each state has its own legislative process, a really unique political landscape, vast differences in our practice acts, our scope, and also in the way that we have our oversight for our boards. However, we are all united as a profession, and so our fates are intimately twined. So it is always a good idea to be watching for what trends are coming up in other states and what we can learn from that here in Florida, and also what we maybe need to be preparing for or have talking points for. So we're going to take a look at two bills, one that has already passed and one that is still in process right now. And the first is out of Ohio. It's House Bill 442. And what we notice right now is a big trend with deregulation. And these are really something that we can learn a lot from. So in Ohio, this House bill that was passed in December, but actually took effect in April of this year, dealt with the occupational licenses and regulations. So in Ohio, they were unique in the fact that they had 2 licenses. The first was for licensed acupuncturists, and the second was for those that practiced herbal medicine, meaning in Ohio, they needed to have either passed and keep up with their current NCCOM, either Chinese herbal medicine certification or the OM diplomate status to be able to practice that. And so the legislature decided to remove that OM practitioner license type. So what that really did is it deregulates the practice of herbal, they call it herbal therapy versus herbal medicine, which is the way we reference it, but that has now taken that out of regulation. And so that has caused some issues because taking something out of scope is never something we really want to see, something that's defined in scope being removed. But it's also caused a couple of issues in their hospital systems there. They can still practice herbal medicine, but it is no longer specified within scope, and therefore some of the larger hospital systems will not be, they will have to change the way that they are doing their herbal medicine programs. And the largest example of that is the Cleveland Clinic herbal program. So that is something that Ohio is now working. They have gotten a lobbyist, and they are working with a lobbyist for the first time now. And the Ohio Association has been very active in this, and they are working now to introduce a new bill that will bring that under the licensure of their licensed acupuncturists, but in a tiered system. So not everyone would need to have that OM or Chinese herbal medicine diplomate status to be able to practice that, but in order to practice it for some of the hospitals and the other systems that want that clearly defined in scope, they would still have that ability if they're successful in getting this bill passed, the new bill. So we'll keep you updated as that comes out, and hopefully be able to update with some great news for the state of Ohio. The second bill.
Ask you a question. My understanding was that the amendment that was knocked out herbal practitioners was added at the very last minute, just as the bill was going to a vote. Is that correct?
Well, the bill itself was introduced very late in session, and it was buried amongst, it was a bill that originally was written for CPAs and some other licensure types. And so the OM licensure type was buried on page maybe 87 of the bill, and it was really mentioned twice. So it was a very, it passed under the radar of many people. When that got added in exactly, I'm not certain, but it certainly was, well, it was deep into the bill, and therefore did not get a lot of early attention. And that's really also something that is, you know, from a strategic perspective, the sooner we know about an issue, the sooner we can begin to address it. And so that is yet again another reason why, you know, working with a lobbyist is so helpful, to have eyes and ears out there. And it's also why, as state associations, we need to be very diligent in checking any new bills that are added and what is actually listed within that as to what pertains to us. So, Ellen, did that answer your question?
It did. We do have on our website legislation tracking app. So everybody should take a look at that, explore it. We need as many eyes as possible. So if you see something either locally in your county, like what happened during COVID, or something that we just haven't noticed, please send us an email and let us know, because we didn't know about some of the counties and COVID making us personal care until somebody told us.
Absolutely. And that speaks to the greater point that we really are all in this together. All of us as professionals and as licensed acupuncturists really need to have eyes and ears on this, because certainly anything that you see, if you see something, say something. And that is why FSOMA is here. We are here to support the profession, to promote and protect both the profession and the health of Floridians. So if you see something that we need to be aware of, please let us know. Some of our best things are coming from the membership, so we certainly appreciate that. So we're going to move on to Nevada's bill, and this is an active bill right now, and this is Senate Bill 335, and this is also a bill that is dealing with deregulation. This revises provisions relating to professional and occupational licensing, and this bill would seeks to, and would, if passed, abolish the Board of Acupuncture, which is the overseer for licensed acupuncturists within the state of Nevada. And it's a little vague what it would be replaced with. It's going to be replaced with an advisory council, but it does not detail, and it's not yet determined who would sit on that advisory council. So would that be an oversight by licensed acupuncturists or by another profession? It's unclear at this point. So what we can see from this, we can see from both of these bills a few things. Number one, there is absolutely a trend towards deregulation that's happening across the nation right now. And it's something that, let's be clear, at this point, there is no active threat in Florida that we're aware of. And we do have eyes on this, and we are working towards this. But it's also something that we need to be aware of. And we need to, it really illustrates so clearly the importance of having a relationship with our legislators, of knowing who they are, and of setting up those introductory meetings, of getting to know them so that there is name recognition when you call, when you ask to set up that meeting, so that you have that opportunity to really educate them what our profession is, in terms of scope, what we do, our education, and also how we fit into the healthcare system here in Florida. And that really brings us to what our FSOMA's advocacy goals are. And, you know, as you see here, we split our goals out for 2021 into quarterly goals, and they all revolve around the same theme of building and developing these relationships. So first quarter was Acupuncture Education Day. Second quarter were video testimonials. And that is something that is so helpful for us to have in our pocket, to be able to email out when we can't see someone live, or be able to deliver, because a story is such a personal, it really personalizes and can tell such a strong message as to why acupuncture is powerful and such a valid part of our Florida healthcare system. So for right now, our third quarter is going to be focused in on visiting your legislators while they are in district. Florida session has ended, so most of our representatives are coming home. There will be a few special sessions, but for the most part, they are going to be home, which means they will be in your, not necessarily county, but in your area. And so it is a perfect time to be able to call and set up a meeting with them. Typically, they've got a little bit more time. They're not running in and out of committee meetings, and it's a little bit more quiet while they're there in district. It's a fantastic opportunity where you don't have to travel far to go and introduce yourself, and also take it as an opportunity to both educate and really deepen that relationship. So Ellen and I will be setting up a future training here. We're hoping to do that in the next week or two, where we will again go through best practices for advocacy, how to set up those meetings, and also some great talking points. So definitely look for that. And if there's any questions, you'll let us know. Please feel free to email. I'm Jennifer@FSOMA.org. Ellen is always available via phone and email. She's incredibly available. And then for our fourth quarter, we're going to really specify what that email campaign is. So that's why it's to be determined. We'll have specific talking points based on any future legislative asks that we're hoping for 2022, or anything that's happening that's a little bit more topic specific. So we will go through that with you. And Ellen is showing you our page here. And
Or
from
go down to legislative campaign and it'll pull up help. This helps you find your folks. We're not going to go in depth to this. I just wanted to show it's there. So
thank you so much. Thank you so much for bringing that up. And not only will you see, can you find your reps from this page, but you can also see lobbying worksheets, which will help you to keep that information organized. You can also see some sample letter writing and a lot of great information that we've put on that page. So it is really each of our responsibilities as professionals and as those committed acupuncturists that really want to see our medicine be available. We want to increase the access and decrease the barriers and really be able to get our medicine out to help Florida citizens. So what we hope to do is that you will get involved in advocacy also, because it really is each of our responsibilities. So thanks so much. If you have questions, let us know. And anytime we can help you with that, let us know. Thanks, Ellen. Back to you.
sure. Well, I'm actually going to send it to David now.
Hey, good evening, everybody. Thank you. That was a terrific presentation, Jennifer. Just a couple of things I wanted to sort of lean in on there is that you are absolutely right when you say it takes all of us, as dedicated as Jennifer and other members of the board are to their projects and special projects. Jennifer's handling advocacy, not only through the ASA and keeping an eye on things around the country, like you saw with her presentation to include Ohio and Nevada, but also watching how things evolve here in Florida. I think that the lesson for all of us is that it's not just enough to go to work and treat patients and go home and give no special consideration to what more you can do to speak on behalf of the profession. And it's a relatively straightforward ask in terms of traveling locally, probably no more than 15 or 20 minutes to a local legislator's office to coordinate an office meeting. You'll have presentation materials provided to you. And it's not that you have to do anything special other than introduce yourself, say, hey, I'm a constituent. I own a practice here in town. We treat, patients that are in the area. These are the types of things we see and do, and be available to the elected legislator as a resource. Somebody that they can call on if they have questions. Their office can reach out to you, and you can also share any questions that they might have with us and help develop that relationship in a way that's meaningful. Because, trust me, Ohio and Nevada are experiencing the other side of the coin, is that when the sands shift, in a way that is not in a way that supports you or your profession, and you feel like your practice is being pulled away from you, your board is being pulled away from you, decisions about how acupuncture is provided in a given state is being put in the hands of non-acupuncturists, that's an alarming concern if you are a licensed healthcare practitioner in that state. And the only defense, truly the only defense that professions have against that is personal relationships with elected legislators, where you can reach out and say, hey, this is something unusual. I think you need to hear me on this question. And so anyway, I can't thank Jennifer enough for picking up where she has with ASA and on what's going on in Florida. And we'll have more to share as the year goes along about our legislative agenda and how best to reach out to folks. But this is work that needs to be done on the ground on a regular basis. And, talk about when the barn, horses being out of the barn, when that happens, there's not enough time, there's not enough money, there's very little that you can do to corral the legislation and get things back in your favor if you're not there, at the very beginning and have an opportunity to sit with legislators. And so fortunately here in Florida, we've got people like Jennifer and Ellen, the board as a whole, Corinne Mixon and our attorneys, they sit that post. They're on that fence and they're keeping an eye on what's happening for the benefit of the whole of the profession. So I ask you to consider that question seriously. So let me jump to the items that are on my agenda tonight. We're going to talk about homeopathic injection update. And I know there's uncertainty about, what's the right option at this time, because we see a lot of questions circulating on social media, both on the FSOMA Facebook account as well as others that are not specific to the association. But I think what's important for people to understand, all healthcare practitioners, this applies to medical doctors, ARNPs, other physicians, including acupuncturists that use homeopathic injections. Going back to 2017, the FDA began discussions with the manufacturers of these products, and the FDA discussed their concerns that the products the drug injectables had not been subjected to a pre-market approval process, as is required of all injectable drugs. And of course, historically, the industry felt like they had a different relationship with the FDA as it applied to homeopathics. And to a certain extent, that's true. But to the extent that it's accurate is that the exemptions for homeopathic products applied to supplements that are oral and topicals that are regulated under the Cosmetic Act. And the question of injectables is sort of sitting in a gray space. Well, the FDA started contacting the manufacturers saying, look, we're going to change the requirements on the pre-market approval for these injectables, and we need you to start submitting documentation for efficacy and safety, and as well as complying with manufacturing CGMPs. And I can't speak for the industry. I don't know what they did or didn't do or how did they responded, except that 3 or 4 years later, starting in 2020, the FDA started sending cease and desist letters essentially to the manufacturers saying, we're going to ban the importation and sale of these products because they are being reclassified as new and unapproved drugs. That started in July 2020. My understanding is that Medinatura and specifically maybe other manufacturers have brought a case to federal court seeking an injunction against the FDA's prohibition on importation of these products. And twice federal judges have sided with the FDA and saying, look, it's within the FDA's purview to decide what's a safe injectable and what's not, and what's subject to pre-market approval and what's not. And so when the FDA says that you can't import this, then it's essentially banning the product for use and sale in the United States. Is that at that point, it's an industry problem. The problem is between the manufacturers and makers and distributors of those products and the FDA. From a provider standpoint, whether you're a medical doctor or any other type of licensed healthcare practitioner, including acupuncturists, these products are not legal for sale and use in the US at this time. They have not been since last July. I keep saying July, but I think it was actually June 20th last year, 2020. And the FDA didn't step in and have manufacturers send cease and desist letters to their consumers, but they were told not to sell the product anymore. And so then it's the responsibility of providers to understand what is an approved and what is not an approved drug product for sale and injection. And that burden falls to licensed acupuncturists at this point. And so when we see examples of providers saying, where is this available? And you have to go to, Canada or England or Germany or Colombia or some other place to buy an injectable product, that should send up a red flag in your mind as to why can't I get it from my common and usual sources in the US? And the reason why you can't is that it's banned for importation and sale, which means that it's not legal to inject in the US at this point. Again, from a best practices standpoint, I'd urge you to take a wide lens of that question and consider its implications carefully. You're a licensed healthcare practitioner, you can do as you wish. to the benefit of your patients, but also taking certain risks when you do that. Certainly in my practice, it's not something that we can continue to do until the FDA and the industry comes to some understanding about legal sale and use of those products. I say that only because, we try not to jump into social media and make a lot of comments, but at this point in time, I just feel like it's necessary from FSOMA's standpoint and a best practices standpoint to make our position clear. Okay. If anybody has any additional questions, you can contact me, David at FSOMA.org, or run your questions through Ellen. Okay.
There is a question in the chat, David.
Yep.
If we can get an injectable from a compounding pharmacy in the US, say Olympia Pharmacy, can we assume that it is legal for use for us to use if you're able to obtain it?
I'm not sure what we're talking about injecting, but I would say that if it is a herb, a nutritional supplement, and I'm reluctant to say homeopathic at this point, but those are the three things that are, that are recognized in our Practice Act or in rule for injectable under AIT. And so I think you just because it's available, just because somebody's willing to sell it to you, does not mean that it falls under the criteria of something that's safe to inject. So it is, consider carefully. It's hard to answer that question because it's as general as it is. I don't know what Olympia is marketing to acupuncturists, but look at the AIT rule and then ask yourself, is what's in this vial something that is described in my rule?
Okay, Amy's answering some questions too.
Well, hey, I welcome Amy's input on this question because it's such a broad and contentious question, and that I would agree that the FDA has an ongoing challenge with regulation with compounding pharmacies, not just as it applies to injectables, but compounding pharmacies in general. And so I would say that I would try to satisfy the question first is this FDA approved? What indication is it approved for? And is that in my scope of practice? Because I also, without getting too far afield on this question, sometimes you'll see somebody choosing to use an injectable for an off-label purpose. Well, if you're not licensed and trained to use it for its intended and approved purpose based on it's the FDA approval of something, you can't just take and repurpose that for some other secondary reason and use it off-label. So again, it's something that, we have, privileges under AIT that certainly we want to understand where the four corners of AIT are, and we want to operate legally inside those four corners. So I think answering the question first, is it FDA approved for the indication that I want to use it for? And two, if you have follow-up questions about that, you might also be asking yourself the question, if I inject somebody with this substance, is my malpractice and professional liability company going to cover me for any adverse outcome? And so that may be something that you want to disclose to your professional liability carrier and ask them, say, look, I want to use this. This is what I want to use it for. This is what it's approved for. And, will you stand behind me should there be some sort of adverse outcome? I think that's sort of the nexus of how you want to approach the question with AIT. And again, there's a lot more discussion, I imagine, on this question, and I'm open to questions, and I'll try as best I can to answer the ones I think I can, and then maybe get maybe Chase Howard or somebody from Florida Healthcare Law Firm if we need a legal opinion to weigh in as well.
Yeah, I think somebody's asking about B12, and that's definitely still available to us and used by us.
Yeah, no, yeah, exactly. Something like this that is, B12 certainly meets any and all of criteria for what's acceptable under AIT.
And Amy actually didn't say her thoughts to everybody, just to the panelists. So.
Oh, okay. Well, the input, I think that, and Amy's input is right on target here, is that ultimately it doesn't specify it in rule because hopefully it doesn't need to be specified, but anything that you inject into a patient needs to be approved by the FDA. Injecting something that hasn't been subjected to a pre-market approval is illegal. There's no fancier way to say that. And I know that you can kind of parse and divide that question by saying, well, I like to combine 2 or 3 things together. And if I use this with this with this, each of the 3 of them are legend drugs that are either subject to pre-market approval or otherwise approved by the FDA. If they're approved individually, I should be able to combine them and inject them together into a patient. That is something that, again, now you're compounding in your own office. Is something that I think ultimately you're responsible for the final product that's coming out of that syringe, and it's something that you should discuss with your professional liability company to make sure that that there's adequate safety and research and efficacy surrounding the combining and using of those products together. Where it may be safe and well understood as why you're doing it individually, but taking and mixing B12 with 2 or 3 other things may be something that would raise eyebrows at your liability insurance carrier. And again, this is just about risk management and best practices. I'm not telling you how to practice and what to do and what not to do. It's just that following the guidance of something you hear online, or even if you do a weekend course and you pay a lot of money for it, it's you want to get your answers from the people responsible for protecting your back, your attorneys, your board if necessary, your liability insurance company. They help you frame the risk management decisions that you make when you're putting together treatment protocols and plans of care. Okay, I'm ready to move on from this question unless anybody has something else they want to ask me.
I just want to just pop in very quickly, David, such great information. And oftentimes when you call the malpractice, sometimes they will, because there's so many variations to this question. So if you say, oh, can I inject, ABC? Oftentimes the answer will be, if it's in your scope, we will cover you. And what that means is exactly what David said. Is it in the scope? So is it one of those 3 substances? And then is it FDA approved? And if it's not FDA approved, either for that use or by name, then the answer is no. The malpractice won't always know specific ingredients per se. So oftentimes they're going to defer you back and say, if it's covered in if it's allowed in your scope, we will cover you. But you still have to scrub that by the questions that David's brought up. Thank you so much, David, for that.
I wanted to make one point too. We've been asked about a specific substance and is it legal? My video's not working, but can you hear me?
Yes.
Okay. If you have a list of what's approved, then you're stuck. If something new comes out that fits the description but isn't on the list, you can't use it. So several years ago, there were people that wanted to get a list and put it in the rules, and pretty much that was the consensus of people that opposed it, was you don't want a list. You want to leave it, up to the profession to develop. But you do need to read the rule and get a legal opinion from a lawyer. Now, there are as many legal opinions as there are lawyers sometimes, but at least you have, somebody who has a legal mind and is looking at the statute saying, well, this fits, or no, that doesn't seem to fit. So, but there's no list of drugs out there, and we don't necessarily want that. So.
True.
Great point.
Oh, so our next topic is the American Specialty Health. Ellen and I had an opportunity to meet with their credentialing coordinator and their medical director to go over some news updates with ASH. And the big takeaway from the meeting was the discussion about ASH taking over the Cigna provider network was scheduled. That news was released earlier in the year, and the handoff with Cigna was originally scheduled for June, I believe, if not the end of June, the beginning of July. And that has been pushed forward to September. And so the credentialing period has been extended with ASH for those providers who want to provide acupuncture benefits to Cigna beneficiaries. The other news with regard to that is that there's been a lot of discussion and concern about the way ASH structured its fee schedule. And those familiar with it understand the question there. And what ASH and Cigna have decided to do, and this applies only to ASH and to Cigna, is unbundle the reimbursement for acupuncture unit number 1 and unit number 2, where they had a flat rate that they were using based on 1 or 2 units. They've unbundled that. And the specifics of the reimbursement per unit is not available yet. They're just saying that they've unbundled it. And I believe that the E&M code structure remains the same as well. They have 3, I think, options for manual therapies like ice packs and a couple of other things, where they're adjunctive therapies that may be used during an encounter. ASH also handles the provider network for Florida Blue, and I'm gonna be careful. I think it's Aetna and Care Plus. And one of the things that they made clear was that, and Ellen will correct me on the number, but I think they have something like 31 million beneficiaries under ASH benefits because they're using the physical medicine credentialing network for ASH. They're aggressively going after more and more insurance carriers to take on, to convince them to outsource their physical medicine benefits to the ASH network rather than continuing to manage them in-house. And so that is going to affect physical therapy, chiropractic medicine, podiatry, and a couple of other specialties, massage therapy. And I think that they probably make a pretty convincing argument, and they're gaining a lot of momentum. They've got a lot of data they can share when talking with insurance carriers about outcomes and patient satisfaction. They're putting those, all of the encounters and all of the data that they're able to glean from that, they're putting it to good work to go out and talk to more and more carriers. And unfortunately, because of some of the, in my opinion, their aggressive pricing and budget approach to some of their physical medicine, including acupuncture, it's a little bit of a challenge for the profession. And so they suggest that they're open to continuing to work with us to find what works best. But that is to be determined. But the news we had relates to ASH extending their enrollment, starting with Cigna in September, and unbundling their 2 units of acupuncture. Thank you. I've got a couple things here we're going to cover real quick. The COVID-19 liability protections.
Oh, David, you froze.
At our last meeting, am I gone?
Yeah, we couldn't hear
Am
you.
I back?
You're back.
Okay. Thanks, guys. I apologize. Quickly on COVID-19, we had an update from Corinne Mixon that House Bill 7 has been adopted, and what it provides is liability protection for healthcare providers, including acupuncturists, related to any tort or legal claims that a patient or a family member or somebody else who is in your office who contracted COVID-19, and that they want to tie that to an encounter in your office. The protections are really pretty robust. It's not to say that it's absolutely impossible for somebody to successfully come through with a suit, but the governor has gone far and wide to make to provide protections for hospitals, medical doctors, dentists, every kind of healthcare provider we can think of, including acupuncturists. There was a little bit of back and forth on that question, but we were able to remain, named and articulated in the bill, so those protections exist for us. It's a successful campaign. We want to make sure that when things like this happen that protect healthcare providers, that acupuncturists are counted among them. The Pip repeal, this is Senate Bill 54. There's been discussion over the last couple of sessions where the legislature's revisited Pip as a form of insurance, auto insurance, and they're removed the PIP options, and they're going to replace it fully with bodily injury. It doesn't provide any real shift for the acupuncture profession, in so much as under bodily injury, most care is going to be provided under a letter of protection from an attorney's office. If somebody's seeking non-emergency care and they want to use an acupuncture physician, there's no special benefits like there was under PIP. But interestingly enough, after 10 years of discussion with PIP, finally the playing field has been leveled where there is no advantage for this PIP pool of money to go to either emergency providers or medical doctors or chiropractors. Everybody is sort of in the same space in terms of patient access and patients' access to us. If there's any additional questions, we can talk about that afterwards. Massage therapy had a modernization bill that passed this session, House Bill 245, and basically the asks on the massage therapy practice was to include the word therapy with massage, to extend the definition to massage therapy, and to make some specifics in the Practice Act that massage is therapeutic, and it's a modernization effort done by the massage therapy profession, which is probably overdue, so that their titling is consistent with their training, and it does elevate the practice of massage to a therapeutic modality. So both of those are important steps for our massage colleagues. The Non-opioid Alternatives Bill, this is House Bill 530. Quickly, there's really no substantive change as it affects acupuncturists. What did was include the electronic delivery of the.
You were frozen, but I think you're getting through. Sorry.
Oh, am I back, guys?
Yeah.
I'm sorry, my connection is maybe a little bit weak. The last thing I was going to say here on non-opioid alternatives is that the Department of Health has included a requirement for prescribing physicians who prescribe opioids to include alternative options that include things like physical therapy, chiropractic care, massage therapy, and acupuncture, among a couple of other things. And the change to House Bill 430 was basically it gave prescribers an option to deliver that pamphlet electronically. So there's been no editing or changes. Acupuncture is still included in the alternative recommendations, but they're going from a trifold physical handout that's in the office to the option of using a electronic delivery of that information for cost savings and for other ease. But that's sort of the legislative update in Florida. At the end of the session, fortunately, there's nothing problematic. The last couple things I'll touch on. Thank you, Ellen. Thank you. Is some work that the executive committee and the board is doing. This is some forward-looking projects. One is with the radiology profession. We're working with partners at the healthcare law firm and reaching out to two large radiology associate groups, one covering Central and North Florida, the other predominantly in the South, to try to educate and provide information to the radiology profession about the scope of practice for licensed acupuncturists, to include imaging for either treatment or referral purposes, and to try to relax anybody's concerns about whether or not this is out of our scope, whether we have adequate training and insurance to be using these types of scripts and orders. For a lot of acupuncturists, this is not a question, but we do have colleagues around the state that have a difficult time getting their orders recognized by outpatient radiology clinics and other inpatient facilities as well. So we're working on this through the Radiology Professional Association, as well as they have a secondary business practices association related to radiology practice. And so we're working with 4 groups, 2 large radiology groups and 2 professional associations. And this is an ongoing, education project for the profession. The Pharmacy Board, this is another project that we're working on with Gabe Warren from Rutledge and Corinne as well, is we're reaching out to the Pharmacy Board, either their general counsel or maybe somebody at the executive committee, to work with them on our prescriptive rights and privileges under AIT specifically, just to see if we can clean up any consideration or misunderstandings about how our Practice Act intersects with prescribing, and to make sure that we have ease and access to any, prescriptive materials that we need to practice acupuncture. And so this is something that's been discussed a little bit earlier in the year, but now that the session is over, some of the stakeholders that we need to work with are more available to us. And lastly, I just comment and ask for anybody that's listening, and then those at large, we had discussions with the FSMTA, the Massage Therapy Association, at the end of March regarding some CEU programs that we had objections to based on some of the specific language that was included in the learning objectives that, pretty blatantly said that this is how do you integrate TCM into the massage practice, into and including recommendation of herbs and other things that were beyond the scope of practice for massage therapists in Florida. So we met with their lobbying team as well as their advocacy and legislative chair, Ian McIntosh, and we raised specific objections about a class that was being taught at 2 of the satellite programs in the Panhandle. And they were willing to take the course down, replaced it with something that we could agree on that was a more appropriate subject matter. And it's the beginning of maybe a broader discussion with the FSMTA about some of what we see in terms of scope creep, but to the extent that they're in the manual therapy practice as well. So we just want to work with them on languaging and some of the intent, and then maybe how massage is advertised and practiced here in Florida, where we have areas of concern. And so it's something that we're watching as an association on behalf of the profession, but I welcome anybody who, sees notifications of coursework that's questionable or anything else that they want to share with Ellen or me to let us know, because we do have an open dialogue with the FSMTA on this question and other similar questions. Okay.
Okay.
Thank you, Ellen. Thank you, everybody, for your participation tonight. It was a great presentation from Jennifer, and I really appreciate Amy's input on the AIT questions.
Okay, is there any other questions out there? We had a few answered offline, but we went over a lot of material and a lot of information. So we'd love you to...
Yeah, I mean, we're busy. There's plenty to do, even in, as things are opening up and everybody's practices are busy, we still have a steady, things that we need to focus on that are forward looking and kind of mopping up things that we've been working on in the past. I already hammered away on the question of advocacy. I just asked that everybody make a few minutes this summer to recognize, know who your local legislators are, make it, be purposeful about just getting out of your office for lunch one day to go down there and say, hey, I'm a resource. If you hear anything about acupuncture, let me know. If you have any questions, I'm here to help. And that way, God forbid we find ourselves in a situation like we see our colleagues in Ohio and Nevada, we're not chasing the train. I want to be on it. I want to be pulling the horn. I want to be holding the brake. I want to be able to control what's happening to our profession in the state. And we can't do it if all of these people are strangers with strange faces. They don't know us. We don't know them. We got no reason to think that they're going to, go to bat for us if we don't put in just a little bit of effort. Okay, guys?
I've been putting out fires for a long time, and that's not the way we need to keep going. So we're taking proactive action, and I think that's great. I have some people that have raised their hands. I'm going to go ahead and allow Dr. Peterson to talk. And I guess if you want to show your face, you can.
I don't know, am I coming across?
Yes,
I don't know how to do the video part here.
that's all right. Did you
No, I
have?
was just wondering if we're still having the conference, it'd be a good time to meet people and see what's going on.
Yes, yes.
All
Yeah,
right.
we have a general assembly where we go through stuff, but we also, you know, you're meeting board members. The board members are all there as volunteers, so you can talk to all of them. And yeah, that's great.
No, I would love to meet with you. You know, just come up. Jen and I will be there. The whole board will be there. If there's anybody that you want to meet with, just, you know, grab us by the arm. You know, we're happy to chat.
I've never been to one, and things are kind of picking back up again, although I'm not getting referrals from the VA. I don't know what they're doing. I think they're working at home, drinking coffee and beer. But I used to get about 90% of my referrals from the VA. I'm a veteran
Right.
myself.
Yep. No, the
And
VA
now
authorization program right now under community care is, that pipeline is thin. And
Yeah, well, that's what I was on.
they had a like a diversion program for acupuncture that was done via telehealth and group, basically NADA, not a protocol, that was being delivered by nurses and other staff in the VA facilities. And so they really took like a 90-degree turn on those referrals to licensed acupuncturists. But hopefully, you know, I've seen in my own practice a couple of authorizations squeak through, so I know that it's not an all or nothing proposition. They're just slow to start releasing authorizations. And my suspicion is also it's going to go back through primary, through pain management, through physical medicine, and then to us.
Well, they're offering the battlefield acupuncture, which might be appropriate since we're in a battlefield right now, but it's not really, being facetious, it's not really something that's really going to help a person for a number of different issues.
Okay.
I've used it before,
Yep.
and it's touch and go.
I agree with you wholeheartedly, and this is a discussion that FSOMA's had. I certainly had it with nurse managers and other program directors at the VA, in that, you know, battlefield acupuncture has its indications, but if you're treating somebody for chronic low back pain, like we typically do, you're better off with hands-on care. It's no different than prescribing you know, something for thyroid, which is excellent for thyroid, to treat a headache. You know, there's nothing, you can't fault NADA for not being good. It's just not indicated for all the things that they're trying to use it for. And so they're going to start getting suboptimal outcomes, and then they're going to start questioning, you know, that approach. But unfortunately, we got to wait for the data, you know, to see a change in course there, I think. Thanks, Dr. Peterson.
Sure. Well, they're kind of slow to advance anyway.
Yeah.
From what I understand.
Couple more
Thank
questions.
you. Thank you.
pleasure. Thank you.
Sure. Thank you, Dr. Peterson. Adrian was asking, where do we stand with PIP? And basically, we're going to bodily injury. I don't remember the date. Is it July?
Yeah, they'll sign that to July 1.
What that means is patients who are in an accident can choose their care. So we can be back in treating auto accident patients. Now, the bodily injury system has very often patients get a letter of protection with a lawyer and you wait to get paid. That happens frequently. There's more lawsuits. Who's going to cover it? They're also putting some stuff in here about your own medical plan if it covers it. But there is the patients, people are required to have a certain amount of coverage for bodily injury in their policies. So and we're on the same playing field now as everybody else. So
I think Ellen said it perfectly, but I just want to reiterate, PIP is gone. You know, that pool of money, this $10,000 that was available for years and years, we had access to that when people chose to come to us. It's gone. They changed it in 2012 and it was shared between emergency medicine and chiropractors. It's gone. And so people are going to buy a bodily injury plan. They're required 25,000 or whatever it is the minimum is going to be. But at that point, it can be used for emergency medicine. It can be used for non-emergency medicine. based on what their insurance company will cover. But typically the way that bodily injury works everywhere else in the country is that it's a tort. It's good for lawyers, because if you get in a car accident, there's no pool of money for you to go get care. So you need to get a lawyer. And the lawyer is going to say, okay, we're going to sue your insurance company or the other person's insurance company, and they're going to start setting aside money to pay for your care. But the providers, whether it's a hospital or a non-emergency provider, is going to basically take a letter of protection, which is a guarantee from an attorney that you're going to get paid at some point in the future. And it's not that great for providers typically, because then you wind up having to negotiate with an attorney in 2 years care you gave 24 months ago. But this is what I say, it's no great step forward. It doesn't do a lot for Floridians. It just puts providers all on a level playing field, where there was certain advantages for emergency care and chiropractors under PIP. It doesn't exist anymore.
So there's a question about mask mandates, and David?
I think the governor, was clear a couple of weeks ago that there is no mask mandate from the government or from the CDC. There are recommendations that can be followed, and if you're in private practice and you, for your own reasons, feel safer and choose to use masks for yourself and your staff, and you ask patients to wear a mask when they're in the office, I think as a licensed healthcare provider, that is within your purview. There's going to be providers that choose not to do that in their medical setting, but I think as healthcare providers, we're sort of obligated to set the standard for excellence and best practices in that way. I know in my office we're still using masks for myself and for patients as they enter the office. We do have a slightly relaxed standard in certain instances where social distancing is possible during consultation, but your question was, is there a mandate? And I would say the answer is no. The stricter, or the practices and principles of using masks are approached from a best practices standpoint. And I think that if you were to visit most medical offices, I know from my own experience, I recently visited a dentist and a medical doctor, their staff, their facilities were still all in masks. And I think that we shouldn't be in too much of a hurry to abandon that practice ourselves, because we're going to be held to a higher standard in general.
Hey, guys, I'm going to hop off. I have a meeting I need to run to. Thank you so much, David, Ellen, for everything you're doing. Thank you so much to everyone who took the time to attend tonight. And please reach out and let's talk advocacy for FSOMA and for Florida and for the licensed acupuncturists in this whole country. So, and for all the patients we can help. Thanks, guys. Have a great night.
For a great job tonight. Thank you.
Thank you.
All right, I don't see any more chats or, oops, here's a couple more questions. So thank you and agree totally. So, all right. I'm going to thank you all for attending. I will post the recording on the FSOMA site. Well, let's see. We do have some more raised hands. Now I don't see them. So put something in the chat if you need to talk.
That, or just email, call us, contact us. We're ready. We're available when you need us.
Okay. Thank you so much. Thank you, David.
Thanks, Ellen.
All right. We'll
Thanks for
talk.
an excellent job tonight. Thanks so much.
All right. Bye-bye.